Well, good afternoon, everyone. I want to thank everyone for joining us today for our July 27th, 2022 public briefing. We have a lot of updates to share, so let's start with first a public health update. Here are the COVID-19 numbers for our city as of today. The city of Richmond has seen 52,548 cases of coronavirus since the beginning of the pandemic. Our 7-day average of new daily cases stands at 106. And as is our custom, I'd like to take just a few moments to pause and remember those that we've lost during this pandemic. That number today stands at 520 residents lost to COVID-19. Thank you. I'd also like to remind everyone that the best protection from serious illness and against hospitalization as well remains to get vaccinated and to get boosted. Now, I've been saying this for, almost 2 years now, Dr. Ferre, and I will continue to say it. The best way to avoid serious illness, to avoid hospitalization, to avoid death, is to get vaccinated. We will continue to urge that. And as always, you can learn about vaccinations and testing opportunities by going to www.vax.rchd.com. That's www.vax.rchd.com. Or you can simply call 804-205-3501. Today, I'm happy to be joined by Dr. Melissa Ferre, who has a special introduction to make as well before we talk a little bit about what the health district is doing on the issue of COVID-19, but also on the issue of monkeypox as well. And so I'm going to ask Dr. Ferre to come up here to make that introduction and to talk a little bit about what's going on health-wise in the city of Richmond. Dr. Ferre.
Hi, everybody. I'm here on a very happy note, actually. But first, thank you to the mayor for your ongoing support during all of COVID and as we move on to other infectious diseases that we are facing in our city. And I want to thank all of Richmond and Henrico in this metro area for having me as the acting director of the health district for these months. It's been a really great experience and certainly one I won't forget soon. Very excited to be able to return to my post as the deputy director for Richmond and Henrico Health District. So I'm not going anywhere, but I will be happy to return to focus in my areas that I normally focus on in epidemiology, infectious diseases. So you might still be hearing from me every now and then since we're still dealing with epidemiology and infectious diseases. But that being said, I am very happy to welcome Dr. Elaine Perry to our team as our permanent health director for the Richmond and Henrico Health Districts. She's a board-certified preventative medicine physician and has a master's degree in epidemiology. Most recently, she's been serving as the interim health director at Central Shenandoah Health District and as an accomplished physician and public health expert. Her values and vision are closely aligned with what we've already been doing in Richmond and Henrico's Health District, and she's well situated to help us continue and grow this important work. So with that, I'd like to invite Dr. Perry to introduce herself a little further and share some updates on what we've been doing in the Health District and monkeypox. Thanks.
Good afternoon. And first, thank you very much, Dr. Ray, for your welcome. I'm both here today and then to the Health District. The Health Department staff have just given me such an incredible warm welcome, and I'm very excited to be joining that incredible team in their very important work, which is very innovative and compassionate in public health. And thank you also to the mayor for this invitation. Again, I echo Dr. Ray's sentiments. Local public health works so much better when you have a very strong working relationship between the local public health department and the local jurisdiction that you're supporting. So very excited to be working with the mayor and his team here as well. So very briefly in terms of COVID-19 updates, again, the mayor shared some very high-level numbers. As you may be aware, both Richmond City and the County of Henrico are still considered to be in a high transmission level, so a high COVID-19 community level based on the CDC's criteria. What this translates into here for us is the case rate is about 243 per 100,000 in Richmond, which is about what we're seeing throughout the rest of the state, a little bit lower than some areas, a little bit higher than others. And our hospitalizations are about 11 per 100,000 people in Richmond, which, again, is definitely higher than we want to be. Vaccination status so far, we have about 57% of people in Richmond, compared to about 72% of Virginians who are considered to be fully vaccinated. Again, following the mayor's strong recommendations, obviously I fully support those as well. We really do want to make sure that people are continuing to go ahead. If they haven't been vaccinated, go ahead and get vaccinated. If you haven't been boosted, go ahead and get boosted. And we are also really encouraging people to follow the recommendations for when you are at a community, the community level is high, to be doing things again. Make sure you're up to date on your vaccinations, follow the quarantine and isolation guidance as always, wear a mask indoors. As much as you can, and then also to really make sure that you're thoughtful about things like increasing ventilation in indoor spaces. If you have an opportunity to have an event outdoors as opposed to indoors, that really is considered to be preferable, particularly in areas such as ours where there's a high community level. All right, so shifting gears and switching over to monkeypox. So again, we've heard a lot about this. Obviously, so it's an infectious disease. It's caused by a virus. It's spreading throughout the globe, and as well in this country and also in the state of Virginia. And so it's spread from person to person, primarily by close physical contact, right? So contact with skin lesions or body fluids from person to person. Now, there are some opportunities for what we call respiratory transmission as well, but again, that's primarily with close personal contact. So again, really trying to emphasize the transmission here is close contact, close personal contact. There are a variety of different symptoms that monkeypox can present with. Obviously, the thing we think about most is the rash, right? So there's a very specific set of kinds of rashes that we look for in terms of monkeypox, but then there are more general symptoms too. So people with monkeypox may have a fever, they may be tired, they have swollen lymph nodes or lymph glands, as people call them, chills, and just sort of general not feeling that well. Earlier this week, the World Health Organization did declare monkeypox to be a condition of global public health emergency, a global public health importance. I could give you some numbers. They are changing rapidly, of course. So right now we're looking at about 19,000 cases across the world, over 3,500 cases in the U.S., 72-ish cases in Virginia. Again, that is predicted to be increasing, and it's increasing day by day. And at this point, 2 cases in the central region of Virginia, which does include Richmond and Henrico. So most of the cases that we're seeing in this outbreak, again, as you may have heard, have been identified in gay, bisexual, or men, trans women, and people who are assigned male at birth, but who have sex with men. So MSM is the acronym that people use for that. But it is very important to remember that that is not all the cases, right? It also is important to remember that one of the reasons why we try to characterize who the disease is occurring in is completely not to stigmatize that group, right, or to call it a negative attention to a group, but to identify those who are most at risk so that our outreach efforts can really be focused on the communities and trying to do the most good to have the most impact. So again, we very, very much want to discourage any sort of stigmatization or discrimination against certain groups. And anybody can get monkeypox if they're exposed, right? So anybody who comes in contact, it is non-discriminatory disease in terms of if you have that close physical contact with somebody who has monkeypox, with their lesions, you can get monkeypox. So what we've been doing here in Richmond Henrico Health District so far, very, very early on, following our traditional public health models, right? So contact tracing, case investigation. We learn of a case, go ahead, interviewing that case, finding out who they may have been in close contact with, reaching out anonymously to their close contacts, seeing how they feel. Have they developed a rash? In the early stages before vaccine was readily available to us, offering them testing if needed, if they had lesions. A quick note on testing, again, just to maybe dispel some myths. You can only get tested for monkeypox if you actually have lesions. So right now there's not a reliable blood test or any sort of test that we can do. Testing for monkeypox, when we talk about that, is really just somebody who currently has a rash, has lesions that we can swab and and send for testing. So again, back to our response. Traditional contact tracing, case investigation, outreach, working with, again, why I mentioned it's important to know what communities may be most impacted so we can really focus our outreach efforts on those communities, which we have been doing, working with community partners, working with our own sexually transmitted infection program and HIV program. So that was some of the things we've been doing, from the very beginning. Fortunately, there is a vaccine, actually there are 2 vaccines that have been shown to be effective against monkeypox, and we have been fortunate enough to receive doses of that vaccine at our health department, and we have been working very hard to get those into patients' arms as quickly as we can. We are following a risk-based prioritization, so again, looking at the groups that are at highest risk, reaching out to them first, both for our outreach efforts, and then we also have an online form, a vaccine interest form that's available on our website. People can call a call center as well to get onto that list. Being on that list, having out that form does not mean you're guaranteed vaccination, particularly since we have limited vaccine and more interest than that. But it is a way of helping people self-identify that they may fit into one of those risk categories that we really are trying to make sure that we're addressing the people in that community to try and get them vaccinated as soon as we can. And so again, the website for that is rhhd.gov and then /monkeypoxvax, so MONKEYPOXVAX, or calling our call center at 804-205-3501. And at this point, by the end of the day, we will have vaccinated a little over 100 people. It is a 2-dose series. We're moving ahead of vaccinating. We're not holding back second doses. The state is telling us that we should be able to have access to those. So we're vaccinating as thoughtfully and risk-based approach as we can, but also as quickly as we can based on our supply and our staffing. We do have, as I mentioned, a fair amount of interest at this point. We currently have about 1,300 people who have expressed interest through that vaccine information form, and the numbers are continuing to grow. So, but that is where we are right now. We have some just general recommendations. Again, if you do feel that you may fit into one of those risk categories, please do fill out the vaccine interest form. Call our call center, talk to your healthcare professional, particularly if you do feel like you have symptoms that could be consistent with monkeypox. It's very important to do that. Consider discussing monkeypox symptoms with any sexual partners that you have. And another thing that's always really of concern to us in public health is, as I mentioned before, case investigation and contact tracing, that really does depend on the public. So if you get the call from us, as we were saying in COVID, if you get the call, answer the phone, we're asking the same thing for the public health support, the public support with this as well. So if a case investigator or contact tracer from the health department does reach out to you, we do really appreciate that you answer the phone, give us a call back so that we can work with you to help identify what risk you may be at. So that is all I have this afternoon, and I will pass it back over to the mayor. Thank you.
Thank you so much, Dr. Perry, and I want to welcome you to the team. Welcome to Richmond. We're looking forward to working with you and the district moving forward. Now, shifting gears a little bit, I would like to discuss one of my favorite events of the year. That favorite event is the annual event in the city of Richmond, National Night Out. This year's celebration will be held Tuesday, August 2nd, 2022. And it is the 39th annual National Night Out crime prevention event that we hold every year here in the city of Richmond. Now, many neighborhoods throughout Richmond will be hosting a variety of special events, such as block parties. There will be cookouts. Some will have parades. I'm hearing about flashlight walks, contests, and other youth activities. These events will be all over the city, and they will receive visits from the police department, other first responders, and you will see me at some of these events as well. Now, National Night Out is designed to heighten crime and drug prevention awareness. It helps with generating participation in local anti-crime efforts. It helps us strengthen our neighborhood spirit and police community partnerships. All of these are key to ensuring that we keep our community safe and that we solve crimes as well. Today, I am joined by Sergeant Tish Edmonds with the Richmond Police Department. She plays a critical role with the department's community care unit. and has been assisting with this effort for many, many years. So, Sergeant Edmonds, could you share more about how to participate in National Night Out that's coming up on Tuesday, August 2nd, and what folks can expect?
Thank you, Mr. Mayor. Hello. Yes, we are very excited about National Night Out this year, and like the mayor said, it's a lot of fun. We look forward to it every year. Your neighborhoods can easily register at www.rva.gov/police, and there's an About Us tab. Hit that tab. There's a link to get your neighborhood party registered. No matter how big or how small, having your neighborhood party registered lets us know that you want us to stop by, us as well as first responders, other city leaders, and it's important for us to know because we would love to meet you, get to know what your interests are, any ideas you may have. Just networking and just having that one-on-one conversation is critical and key to the partnership that community policing is all about. So like the mayor said, there are parties, there's flashlights, parades, there's cookouts, there's contests, there's bingo games, there's water slides, and a lot of food. So it's a lot of fun to get out, and it's all about building relationships, getting to know everybody in your neighborhood. And if you're not having a block party, it's okay to cut your porch light on. I encourage you to go into the Nextdoor app and get to know your neighbors that way. If you don't want to do the person-to-person thing, you can always start your neighborhood watch program back up. Just get out there and get connected. We've been inside with COVID for a minute, so please get out, meet your neighbors, get to know your city leaders, your first responders, because we would love to get to know you. And lastly, the parties are all outdoors, so outdoors is good. According to what the doctor just said, outdoors is good. We're expecting wonderful weather, so I encourage you to host a party or join a party in your neighborhood and get out and meet your neighbors, and we would love for you to come meet us.
Sounds great.
Thank you.
Thank you so much, Sergeant Edmonds. You're right. One of the things I love the most about National Night Out is the food, the fun, but also the people as well. Getting to see so many people. Now, last time I think last year, I tried to hit 7. I hit 7 stops last year. My goal is to do 8 stops across the city. So anybody out there tracking, or if you want to invite me to one of your National Night Out parties, please rvamayor@rva.gov. Invite me. I'll do my best to make it there. All right? National Night Out. Just want to say a quick word about public safety here in the city of Richmond. And as you know, it's our number one goal to keep our community safe no matter what part of the city you're living in. Now, I know that we've had several shootings recently in Richmond. My heart breaks, obviously, every time I am alerted by the police department about a shooting or a homicide here in our city. Now, our police department, in collaboration with our community safety coordinator and our human services team, are being proactive. RPD is intervening and going after the folks who are pulling these triggers, who are doing the shootings. And our human services team is ensuring prevention tools are in place. We are taking a both-and approach to this work. Not an either-or, a both-and. But this work is challenging. And when it is so easy, too easy, for folks to access guns and firearms, it is way too easy for a piece of metal or a bullet to change a person's life or a family's life. Just like that, a life can be taken. And that's why I will say it till I'm blue in the face, we need gun safety reform. Period. Hard stop. Gun violence is impacting every community, whether you're living in rural areas or urban locales like the city of Richmond. Homicide rates in rural America have rose 25% in 2020, and that was according to the CDC. The largest rural increase since they began tracking such data in 1999. We know that states with the weakest gun laws, those who were given an F grade, saw 61% higher homicide rates than states with the strongest gun laws, those states that received an A or B. That is why events like National Night Out are so very important. They bring the community together. They raise awareness of both resources and advocacy opportunities. So, I'm going to end today by asking that you participate in National Night Out, but also share your story. Engage with your police department and to ensure that all of our communities stay safe. I'm looking forward to seeing everyone out next Tuesday. Now, we're going to end on a lighter note. Richmond has a lot of pride. We all know that. And there are many things to be excited about in our great city that are going on right now. One thing that we are excited about is our love for our bicyclists. And last week, we unveiled a brand new bike lane sweeper. Yes, this is your common local government announcement that gets us all psyched up here. We unveiled a new bike lane sweeper, and we want all the Richmonders out there to play a part in naming this bike lane sweeper. We've crowdsourced your ideas for the hashtag RVA Sweep 16 bracket. That bracket is right here. If you haven't seen it, this is the Sweep 16 bracket. And we have seen names like LeBron James, Bike Dyson, Meryl Sweep, and many, many more. Now, I normally don't tell you who I'm going to vote for, but I'm going to tell you today, I'm voting for LeBron James. So starting today, you can also chime in and vote for your favorite name by working with our friends at Venture Richmond, going to their Twitter account, which is @VentureRVA. The winners will be announced, and the next round starts this Friday. So look out for more information on the formal naming of this RVA bike sweeping machine. I'm hoping and pulling for LeBron James. All right? On a lighter note, things are happening in the city of Richmond. With that, we'll take some questions.
Mayor, on the allegations from the lieutenant governor, there are serious allegations. Obviously, he said he's going to the FBI with them. I guess what's your kind of overall comment on where we are with this right now? And then would you also be willing to go to the FBI to clear all this up?
The question was about the former lieutenant governor's allegations. And Henry, I will say what I said in 2019. Those allegations were baseless, they're false, and frankly, they're ridiculous. You know, we believe in the survivors, and these are credible women who've come forward. And so they were false, ridiculous, and baseless then, and they're false, ridiculous, and baseless now. Remember, these are claims by individual who's been accused of rape, bottom line. And whether or not, right now, the FBI has not reached out to me, has not reached out to anyone part of my, operation. So, only person talking about FBI is one person, and that's the accused rapists who are making the claims.
And Mr. Mayor, just regarding back to the recent violence, I know the mass shooting over the weekend, second one this month here, you mentioned some of the steps being taken, but is anything more being discussed here in light of what happened over the weekend? I know you have the gun violence prevention framework. Any update to that, specifically the violence interrupters that getting higher potentially?
The question was about violence in the city and any update on our gun violence framework that we've have in place, we've been implementing. I will say this. I know the recent incident occurred adjacent to, near a business. We will be strengthening the regulations around operating a business and the rules. We want people to follow the rules. And so if you are not following the rules, this is the time to tighten up, because a team on a task force that have a Richmond Police Department, Richmond Fire, and Code Enforcement will be making visits. And if you are out of regulation, out of code, expect to receive some sort of penalty. That is going to happen. So we have that going on. Obviously, we continue to focus on our both-and approach of being tough on crime, of tough on the root causes of crime. You've heard the chief talk about Operation Red Ball to get firearms off the street in areas of the street that have been seeing a lot of gun violence. I'm proud of the success of that program, but also finding those offenders who are willing to harm others by pulling triggers. Those folks, getting them off the street as well. And also, we're going to continue to lean into our human services approach as well. More after-school programs, more funding for grassroots organizations ran through our nonprofits. We are working on a buyback program, as you know, and also working with violence interrupters when those violence interrupters are in the last stage of the hiring process.
Can you say how many of them are in the last stage and when they might be hired?
I believe 3 to 4. 3, yes, 3.
When they might start working?
I don't have a timeline on when they will start working. I just know that they're in the last stage of the hiring process.
Did you have a question on monkeypox?
I was going to say, for Dr. Perry, regarding monkeypox, by my recollection, there was the initial shipment of the 340 vaccines. First off, again, as far as I know, there's one case in Central Virginia. Can you say if that was in the Richmond or Henrico Health District, and just are you expecting more vaccine shipments? Any word on that?
So in terms of the cases, there are 2 cases so far reported in the Central Virginia region. Because of the low case numbers, we are not reporting them in any smaller geographic distribution, so we can't say whether the specific health district, again, mainly from a patient privacy perspective, we want to just keep it to the region, and that's a decision that's been made at the state health level. In terms of the vaccines, yes, that number is correct in terms of how much we have received so far. We are continuing to reach back out to our central office to continue to order vaccine, and we fully expect to be continuing to receive vaccine as we are being, like I said, we're really moving ahead, vaccinating people as quickly and as safely as we can. And so by showing that, we fully intend to continue to keep receiving more vaccine.
Lyndon. Lyndon German, Richmond Times-Dispatch. A few questions here. I'll first start with the report from The Intercept. You said, like as you said, characterized this investigation is ridiculous, kind of fair facts. But is there anything in it from yourself or your office today to voluntarily come forward to the FBI and cooperate with them as this investigation goes forward, or are you just going to wait for them to reach out?
The question was, are we going to wait for the FBI to reach out, or will we volunteer? If the FBI reaches out, obviously we'll respond, but as of this day, nobody from the FBI has reached out to me or my team. And remember, the only person who is claiming that there is an investigation is someone who's been accused of rape by 2 credible women. No one else has said anything about an investigation but the individual, Justin Fairfax, who's been accused of rape.
Second question here. We have seen some of the new body cam footage regarding the police interactions with protesters at the Marcus David Peters Circle. I'm wondering if you have seen this footage and if you have any reaction towards this new evidence that kind of further contradicts what police have been said about that incident that day. Any reaction towards that?
Any reaction towards essentially the collection over at the Library of Virginia? Have not seen new footage, but I want to remind those who were not here some roughly 2 years ago that the next day after the incident that occurred at the Lee Circle or Marcus David Peters Circle, I stood on the front steps of this city hall and apologized for the mistakes that were made. And I'll be the first to say, I was the first to say, mistakes were made. And so we welcome the collection at the Library of Virginia because I believe this is a learning opportunity. It's a learning opportunity not just for city government, it's a learning opportunity for the Richmond Police Department, for our city at large, and for other communities to learn from.
Last question, Lyndon. You got other people to go to. Yeah, let me reframe here then. So the Times-Dispatch submitted a FOIA request to you and to the Richmond Police Department regarding some correspondence leading up to the press conference for the mass shooting at the hotel. There were some documents that you refrained citing some FOIA exemptions. I'm hoping that you're willing to say whether or not, or why you decided to refrain from handing questions of what they may or may not contain.
That's right. The question is about the press conference that we held post the 4th of July potential of a mass shooting. And yes, we are following the Code of Virginia. And the Code of Virginia lays out, when it comes to FOIA, that municipal executives, like myself, the governor of the Commonwealth of Virginia, are protected, their confidentiality is protected through working documents. Those documents are protected, and that's always been our policy since day one, since I took office here in 2017.
Dean.
Mr. Mayor, following up on the Intercept story, I know that a lot of questions. I spoke with Mr. Fairfax last night. He had mentioned that the investigators asked repeatedly about your connections with Mr. Williamson and former Governor McCullough. I know you denied knowing about any allegations. I was just wondering if you had any response to that, because he had mentioned, they asked about possible misuse of funds, possible connections with money connected with one of the accusers, Dr. Tyson. Wondering if you had any response to that allegation.
I mean, my response to those allegations is the response that I had in 2019, that we had absolutely nothing to do with the situation surrounding Mr. Fairfax. Mr. Fairfax was accused of rape by 2 credible women. And, you know, these baseless claims continue to come back from him again. And, you know, we've again told you that what we know, and we know absolutely nothing about his situation. If you have information that you want to show us that Mr. Fairfax may have, we'd be willing to take a look at it, but no one's shown us anything beyond that.
Thanks very much, everybody.
Thank you,
Appreciate
everyone.
it.